Let's go ahead and get started. A couple things that I do want to share with you is, again, if you have questions, comments, something you need clarification on, please put those in the chat box. And at a minimum, please select all panelists. The other piece that I want to share with you, and I will put in the chat box right now, is the link to the DHSS COVID webpage. So that page, you can access reporting, PPE information, COVID-19 activity. So be sure to grab that link if you don't have it, bookmark it, have it there for an easy-to-use reference point. And with that, I will turn it over to our presenters today.
All right. Thank you, Heike. Good morning, everybody. It is a cool, rainy day. We have like a 40-degree temperature jump in the state of Missouri between yesterday and today. Fortunately, it's still 77 degrees in my house. I am under quarantine for a contact that I had over the weekend. I am doing fine, but we did just find out this morning that my husband is positive for COVID. So we moved him to the basement yesterday in isolation. He's feeling fine. He asked for a stick of butter and an onion this morning. So who knows what's going on down there? Not me. We've also successfully Lysoled our whole house. So just, making it real today for us. Unfortunately, that means, and a lot of you guys know this, I do have a 10-year-old and an 11-year-old, and Halloween is one of our favorite holidays. So it's canceled this year. So if it's raining that day, that's exactly what I ordered. Because if I don't get to play on Halloween, I don't want anybody else playing on Halloween. I'm just kidding. Moving on, trying to make light of my not-so-light day. Fusion updates. You guys have access to the numbers. We posted, again, a link in the side here to the information. So numbers aren't great. Hospitalizations we're monitoring very closely. We do know of specific situations where hospitals are having to transfer patients, but overall the hospital system is okay and manageable. Like they've been telling us, there are pockets where there are concerns, but in terms of bed space, ventilator availability, and ICU availability, everything is okay, especially for this time of the year. And they are starting to see flu cases come in. I've heard of more than one case where they got a COVID test and an influenza A test, and it came back negative COVID positive influenza A. So if you've not got your flu shot, make sure you do that. It's very, very important. But I wanted to kind of give you that frame of reference around the hospitalizations in case you're hearing rumors. That doesn't mean that our healthcare workforce, and this is the individuals, this is the workforce that supports the individuals that we serve. This is my personal workforce for our facilities that the state operates. This is every nursing home in this state. This is every in-home provider in this state. This is every hospital personnel in this state, whether they're a nurse, a doctor, a respiratory therapist, a CNA, a direct care professional. It's extreme exhaustion, and I can't say enough about that. It's extreme exhaustion. There's not a lot that we can do to stop that extreme exhaustion, but the Fusion Cell is next week, over the next few weeks, going to try to look at ways to access other parts of the workforce to help us out, to give us some relief. We've actually, for the state facilities, are working on putting a call out to all other state employees at this point, saying, because we know a lot of folks get jobs during the holidays to help pay for their holiday bills, and we've got jobs. And if you're a state employee and you're looking to work somewhere else, you can come work for us, and that helps your retirement. That helps lots of different things for you. So just really getting creative about how we think about how to get that help too, and hopefully that group that we put together will help us do that. Testing update. I kind of want to talk just briefly about the saliva test. So and I know you've probably seen this. I know the governor announced this week that they've got one of the Washington University testing machines in Kansas City, and I'm not sure if they did Cox South yesterday or what day they did that. My days are running together now because I'm at home. But I know that those machines are getting distributed across the state. Hopefully we will have more broad access to saliva-based testing in the future. I know in the St. Louis area, we are working with a very small group of our facilities to start piloting testing with our facilities with WashU. And when I say small, like 50 people, but it's a start, and hopefully we can get more access to that kind of testing. Also, I know you're probably hearing a lot about antigen testing, and that's it's the equivalent of a pregnancy test for that's how quick it is. So you do an individual can do their own nasal swab. They put it in what's called a little card. It looks like a credit card. It's called BinaxNOW, Now, and then you have an antigen test result. If there's some things that so antigen testing it's got its place in the testing world. It's not the solution for everything, but it's a really good screening tool. But if somebody is negative on an antigen test, that doesn't mean that they won't turn around and be positive on a PCR test. If somebody is positive on an antigen test, it doesn't mean that they will turn around and be positive on a PCR test. But if somebody is symptomatic and positive on an antigen test, then they are making the assumption now that that person is COVID positive. We don't need to run a PCR test. If somebody is negative on an antigen test but symptomatic, they still will run a PCR test. So wanted to talk through that a little bit to see I know that you hear a lot about all these different kinds of testing, and I'm trying to do my best to keep you up to date on what's going on with that. Those are kind of the two big areas right now. We don't have a lot of that antigen testing in the state. We do have some. Most of it is directed to long-term care facilities, and long-term care facilities use it as part of their screening process, but they're also still doing the PCR test. So don't think an antigen test takes the place of the PCR test. Also, there's some confusion around the saliva testing. The saliva test is also a PCR test. So it has to, while you just get to spit in a tube instead of having your brain picked, you do still have to it still has to go to a lab. The test still has to be run. So I'm going to just kind of talk through some of that with you all. I don't really have much on a budget update at this point. We got our really good budget news last week. We still continue to monitor everything, still looking to see what we get from the federal government. Nothing there has changed. CARES Act funding. So good news, we are starting to get more receipts in on the CARES Act funding. I get an update on this every Thursday or Friday. This is the $20 million that got appropriated to us in the General Assembly last year, and we were authorized to start spending in July. Our last day for invoices, and I know Wendy's going to address that, so I won't speak to it too long, but the last day for invoices is November 15th. We have paid out $5.5 million so far. We've got $2 million in process. Just a reminder that you send that invoice to PR, provider relations at the regional office. The regional office sends it to DMH central office so that we can get it keyed into the accounting system, because this isn't a Medicaid claim like we're used to running. And then it has to go to the Office of Administration for final approval. So there's a lot more steps on getting the money actually processed. It's not that they are reviewing it. It's steps to getting it processed because of the type of funding it is. So like I said, $5.5 million paid, $2 million in the process. That's good. That's moving a lot better now. But still, if you're sitting on those, you need to get them into us quickly, because sometimes we run into problems. You may not be a vendor in our SAM2 system. And if you're not a vendor, we have to get you set up as a vendor. All those things take time, and I don't want you guys waiting till November 15th and then find out that I can't process your payment. So early is better. Please, please, please. Also, there's been another round for the Federal Provider Relief Fund that's been put out there. I know that Angie is taking a look at that on the state side, but it looks like we have to refile everything that we'd already filed before. We didn't get money the last time, so I'm not sure if it's different if you previously got money. We didn't get money the last time, so there seems to be a lot of steps in it for the next round for people who may not have got money last time. I'm not sure what the impact is on folks that did get money last time. Vaccinations. So the governor announced last Thursday that the state had submitted our COVID vaccination plan to the CDC last Thursday. And the COVID vaccination plan talks about our priority populations. And, of course, it's individuals. Remember, COVID is a health-related issue. So if we've got individuals with developmental disabilities that are really healthy, which I know we do, and don't have underlying health conditions, and they're not living in congregate care facilities, it falls under where your health condition falls and how your living situation is. So individuals that are high risk, that live in high risk settings, any type of congregate setting, there isn't a really limit on what congregate is. It's not 6 or more or 7 or more. Then those folks are going to be higher up on the chain in terms of getting the vaccinations. We still don't know when vaccinations will be delivered to the state. We still don't know what the best way to access those vaccinations really is. The White House actually last week put out something called the Pharmacy Partnership with Long-Term Care for Vaccinations. And I'm still trying to figure out if anybody in the state has more familiarity with that. We know the basics, which you can all read in the press release also, that they are going to be distributing vaccinations directly to large pharmacy chains like we do flu shots. You know, every CVS, every Walgreens, every grocery store has their free flu shots. I'm not sure who of those types of large organizations are going to get access to the COVID vaccine, but then you as a long-term care facility can choose to partner with one of those entities to get your vaccinations done. It sounds like a pretty good idea, and I don't mean to say that facetiously. It sounds like. I think that's a good way to go, especially if you don't have I think that'll be easier than trying to acquire your own vaccination, I guess, or trying to get a vaccination through primary care or something along those lines. But that's all I really know at this point. Now, I've put the question out to the Fusion Cell, and hopefully we get some additional information. I'm guessing with most things like this, we get information about the same time that everybody else will get information, and it's in the form of press releases. So if we can get more access to that, we will share that with you, but otherwise that's kind of where that lies. I don't have any specific questions on the agenda today for me to address, although I think I kind of did address some. I do, however, want to speak to the number of – hold on, I got to turn that off. I do, however, want to speak to the number of cases we've got in the community right now. So there are 644 individuals that we support. Now, remember, this is just individuals we support. We don't keep track of staff at our provider agencies, but 644 total individuals we support that have been COVID-19. Unfortunately, we've had 15 deaths. We had another death this week. I hate to see that number go up. 158 providers have been impacted by COVID, and in the last 7 days, we've had 52 cases of COVID among the individuals we support. So continue to do what you're doing. Trust me, you can't keep it out of your house. I know that. I'm living it too right now. But continue to do what you're doing. Access to testing. We continue to get those requests from providers. Keep those coming in. I will tell you that access to N95 masks in the PPE world is not getting easier. It's getting harder. So if you can find ways to continue all your preservation efforts on your PPE side. And with that, I'm going to turn it over.
All right. Thanks, Val. This is Wendy, and I just wanted to cover a couple more pieces of information in regards to the CARES Act requests that are coming in. And I encourage all providers and any of our PR staff that are on the call to join the Stories from the Field call on Tuesday, which will be led by Wanda Crocker, who is our PR lead, and she will be talking in some more detail about that process. We know that we've had some providers that have struggled or stumbled in getting through the process and getting all the pieces, parts together. So we have made some changes with our process and moving it through the system and the different steps that Val described earlier. Before, providers were only getting emails really when we were missing things, like the attestation had a problem with it, or the invoices were incomplete or didn't exist, or whatever. We are now going to copy the person who sent the invoice or the request in to the regional office. We will be copying that person when the PR staff sends it off to the next step. So you will know when it moves on down the process, and you won't have to just wonder if it's moving, or is it stuck somewhere, or did it fall through a crack. We've also asked that the CEOs or the executive directors of the organizations be copied on that email so they also know where it is. What we're finding is that we're getting questions through avenues and from people that aren't a part of submitting the process. So by the time we get the question about what's going on, why is this late, it's already been addressed and handled. So it's more of a timing issue. And someone described it as like trying to play catch on a merry-go-round, and I thought that was a perfect visual for kind of what we're experiencing on that. So encourage you, if you've got questions, you haven't gotten that follow-up email, our PR departments are really working hard, and we'll be getting those requests turned around at the regional office level within 48 hours. So if you haven't gotten an email or you don't know where it's at, please I encourage you to reach out to the PR department of your local regional office, or have the person that submitted the invoice reach out to the PR staff of the regional office, because they're going to be able to tell you where it's at in the process and what is going on. Then, as Val said, it comes to the division at central office, and we have to do some things. Again, we are planning on copying the person who submitted the invoice at these steps so that they will know where it's at in the process. Once it moves from the division at central office to the department, the central office of the Department of Mental Health, and then on to OA for final processing and payment. The problems that we tend to have when things slow down or things get returned is invoices are missing. They have to be sent with the request. We have to see what those invoices are. If it is a bill or an invoice for something that you've got in your payables and you're paying in the future, that is fine, as long as it's showing that this is what you're purchased and this is how much it's going to cost, and that's in your payables. It doesn't have to be necessarily paid in full at that point in time that you send it in, but we do have to have the detail to know what it was that was purchased, so that we can review that. So we have gotten some requests that don't have any invoices, don't have any receipts attached, and so that just creates a lot more time for you guys on your end if you then have to get the receipts, and we're getting down to the wire, so we're all getting a little nervous about being able to get everybody the money that they're entitled to. The other thing is that there are some elements or missing information from the attestation. So please just work with your business office staff to pay extra close attention to what is needed there. And again, Wanda on the Tuesdays, the Stories from the Field call, will give you more specific information about this is exactly what is missed, or this is what we need, or pay attention to this. She knows those really in the dirt details that I don't necessarily have. So I encourage you to jump onto those calls. And I also invite our providers who have already received their money to also join those calls, because we may look to you or other providers who are struggling with the process or trying to figure out how am I assuring that I'm not getting reimbursed twice. You might be a really good resource for those questions that come in on the call too. So providers, please join us on that call. Whether you've received your money or whether you haven't, you can help out with that. Or if you'd like to join the panel, please let Heike know. When the request gets to central office, the problem that we generally have is it's got the wrong business address on it, or it's got a different business address on it, or the NPI number is different than what we have. And like Val described, these bills are being paid through a different system. They're being paid through a SAM2 system, which is different than where you get your waiver payments, your payments for services that you're rendering. And so if you're not used to or haven't gotten a payment through that system in a long time, your office may have moved, you may have merged, or for some reason you might have two NPI numbers, and so it might be a different NPI number that's in there. So just be thinking about those pieces, and PR is going to be working with central office to make any of those changes that they can help facilitate on the fly, like with the NPI numbers and verifying if it's a different number. So it doesn't have to go back to you, the provider, to fix that to the extent that we can. So just know that our staff internally are working to try to problem solve and fix some of those things instead of sending it back to you to the extent that we can. Cannot emphasize enough, please give us enough time to turn everything around. Anything that is received after the 15th will not be processed. Anything that is received before the November 15th, we will process, but you've got to be watching for that email to come back. If there's any information that we need, you've got to get it back to us very quickly, or you're going to miss your window of opportunity to get reimbursed for that. The one other thing that I wanted to mention, that just in relation to the CARES Act funding, is we've had some of our regional office nurses working with providers and trying to figure out how they can get some equipment covered and paid for, like if they need pulse oximeters for houses or blood pressure cuffs, or they've got someone with a chronic heart condition that they need a specialized stethoscope so that they can fully utilize StationMD services. You can request those types of items through the CARES Act funding. So please use that. If you're a MARF provider, you might already be working with MARF to get those things covered through a grant that they received. And if you're a family on the line and are needing something, please put something in the chat. And we're looking to see if there are other opportunities out there that have been working to help families. So if you're a family that's on the line and you need a digital thermometer or a pulse oximeter or something along those lines, put it in the chat and we will see what we can do to help you as well. So I think that that's all that I have around this, and I'm going to turn it over to Kim.
Hi, this is Kim. Wendy, you covered actually the information, so thank you for that. And I didn't have anything else today.
Oh. I'm sorry.
Oh, no, that's totally fine. I appreciate it.
All right. Then there's not a lot in the chat today, so I think that's all. Oh, yeah.
Can we get the one in here about the OT costs? We have been told that we can submit for OT overtime costs when what detailed information is accepted as information.
Okay.
So yes, you can submit for overtime if it's related to providing coverage, during COVID and for those things. I believe, and Wanda is going to have more detail, or I'm going to look to Angie to say what detailed information is needed. We just went over that, and I am not entirely sure where we settled. So Angie, do you remember that, or we can get it out in the questions?
We can work on it with the questions document.
Okay, so we will get that information around what detail information is needed to come in the questions when we post that.
All right. So I think that's all we have for today. Thank you again for all you guys are doing. We'll keep the information coming. Thank you for tuning in every week also. We have a lot of people to listen to this call every week, and we really appreciate it. We want to keep making these meaningful for you. So wear a mask, wash your hands, and for me, use a lot of Lysol. And we will talk to you all in a couple weeks. Thanks. Have a happy Halloween. Bye.